Right, the speakers, slightly different from the initial flyer that went out, in that Hannah McConnell, who was actually going to be talking about the progress so far with the review and the approach to the review of birth, child and infant mortality outputs, is not available to make it today. But we do hope that some comments and reports on that will be able to be available, and we'll post that on our pages where all the material is posted. This is under the Stats Usernet. If you go under the health and care theme within Stats Usernet and look for webinar material, you will see all the material from our previous webinars, and also everything for this webinar will be posted. The presentations will be posted fairly soon after the webinar, and then the detailed report will be posted when it's available in a week or so's time. So we have as speakers Rachel and Sarah from NHS England talking about the Analyst X community. In terms of looking at the way forward for user engagement, I think it's very interesting to see how these communities of practice are built up and how they then fit in to the previous more kind of user group organization with user engagement. So they will be telling us quite a lot about that, and then we can talk afterwards about how that how we link into that in terms of user engagement. Then Tegwin Green from ONS will talk about the strategy, the user engagement strategy, the plans for that and where we've got to so far. And then I'm afraid I'd change hats, and I will actually do a short session speaking on behalf of my colleagues within the Statistics User Forum, offering some comments on what Tegwin has said about the strategy and how the user community sees that going forward. As always with these, we'll run through all the speakers, and then we have a Q&A session at the end. And as I say, please put any comments or thoughts in the chat so we can capture that at the end in the Q&A. So that's the introduction. So without any more ado, I'd like to hand over to Rachel and Sarah to tell us about the Analyst X community.
Thank you ever so much. So yes, I'm Rachel McIlroy. I'm a senior programme lead in population health management in NHS England. I am a chartered statistician by background, but my passion really lies in, so what? What does that information tell us? How do we use it? How does that help us improve health and social care by the sharing of that information and the sharing of that learning? And I am what's officially known as an AnalystX champion. So we have a number of us who are unbelievably nerdy and passionate about this kind of stuff, and therefore try and speak about it at every opportunity. I've been a member of HSUG for a while, but I was really delighted to be able to come along and share some of the work that AnalystX has been doing, and tell you all about it and hopefully get you involved. Next slide, please. So in keeping it very, very simple terms, what is it all about? So AnalystX is a community of practice where we are trying to lead, and I think doing a pretty good job of leading, the movement for data-driven evidence-based decision-making. So that's one of the most important things that we can be doing in health and social care right now, is using this vast, enormous amount of information available to us to make better decisions. And one of the ways that we can do that is by actually sharing our existing knowledge and learning across the boundaries that we've been used to working in. So we're not just talking about a particular trust doing something innovative or a particular borough doing something innovative. We want to be able to support the learning and journey that those analysts are going on to say, hey, I've done something really exciting. I'd like to share it with you. Maybe you want to use it too. Next slide. So the community was established around March 2020. You may recognise that date in relation to a fairly significant event that kicked off around about that time, where we have learnt how invaluable data is to making good decisions. So a lot of this work came out of COVID and bringing together that information to have that proper response to the vaccination programme, to understanding those communities that are maybe marginalised or can't access those healthcare services. And Now that we're hopefully coming out of the other side of that, we have learned an enormous amount during that period. And so we want to be able to build on that and share what we've learned and how we think we can apply it to health and social care going forward. So we have a couple of things. We have a vision statement around what that community should be. So I've just touched on about the fact that it's data-driven, evidence-based decision-making, but it's a thriving community. It's a community that has people engaged in it that want to kind of come along and say, I did a fun thing, you should know about it. Or I don't know how to do the first bit of information about this new data set that I've had dropped on my desk. Where can I go and find out information about that? And it is a community of like-minded people, analysts like you and I, who are going, I don't remember how to do that particular transformation, or I don't remember how am I supposed to adjust for mortality in this particular data set. And there will be people who are very, very keen to help you and let you know. So our mission statement then is around connecting and empowering that community to do just that. How do you have that in place that anybody has got somewhere to go to be able to ask those questions, or to be able to put forward what they've got to share, or, you know, just have a chat with other people that are working on the same thing that you're working on, learning that there are other people working on the same thing that you're working on, and that maybe you could do something collaboratively. Which leads very neatly onto, and not planned at all, our values, the first of which is being collaborative. It will not work unless we are doing this as a community, and that everybody has that shared vision and shared approach to doing this collectively. You know, we've learned so much by not doing things in silos and by stepping outside of our own little narrow area and going, what does this look like for everybody else? So collaboration is at the top of that list. There then has to be leadership and direction. Somebody kind of has to take that responsibility, but that is for anybody within that community to say, actually, we haven't got an area that looks at this. I'm going to set one up. I'm going to lead that. I want to push this agenda forward. Innovation is at the heart of what we're doing. So there are some fantastic little bespoke pieces of work. There are some fantastic enormous bespoke pieces of work that are happening all across health and social care and wider areas, now that we're talking about system working and working with other partners, that are just like, that's incredible. How did we get to that point? How do we make that work? So it's an area to be able to share that kind of learning. Must be trusted. Must be that we're not going to go away and sell what you're telling us to competitors, or that we're going to, you know, go and say, oh, you've done some terrible work and we're going to rubbish it. No, that's not what this is about. It's a trusted environment to share. Do I know this? Do I not know this? How do I learn this? And what should I do next with the information that I've got? And we want it to make an impact. It's already made a fairly significant impact, but let's build on that. Let's keep that momentum going. Let's see what we can do next. There will always be an opportunity for us to use data for the greater good to be making that impact. Next slide, please. So what actually is it? What is a community of practice and what is it not? So it's not a specific project. It's not going to start, have a middle, have an end, and then wander away. It's not just a kind of informal network of people getting together over a coffee, although that happens too. And it's not something that we're necessarily trying to set out and measure of, you know, we did this thing, we had this intervention, and this is what happened. Doesn't necessarily have that predetermined objective. However, what it is that lovely use of a Venn diagram that shares domains of areas of shared interest, a community that's the relationship that's built up around that, around activities, discussion and learning, and then putting that into practice. What is that body of evidence that we've built from using those techniques, from hearing from other people, from understanding what new tools have been applied, from, you know, case studies around doing a piece of analysis, and all just bringing all of that together to continue to learn. The roles on the community of practice and across AnalystX are defined by the people being part of it. So you might want to have a common interest around a particular practice. You might have a particular interest in a type of data or a type of analytical technique. And so those areas then spring up from what the users themselves are dictating they want to see and that they need. It's not some sort of great overall plan that we have that we must tell everybody about this thing, and then like 4 people go, well, okay, that was interesting. It's about what the community actually want right now. And because it's very agile and very driven by that community, you can have start up a conversation, and 20 minutes later you can have a couple of hundred people chipping in going, oh yeah, I'm working on that too. Oh yeah, that's very interesting. Oh, I'd like to meet up with you and have that conversation. So it's very organic in that respect. Next slide, please. The next, again, I think probably brings up the animation. There we go. So in terms of what a community of practice does, there are sort of those 5 main areas: education, support, cultivating that discussion, encouragement, and integration. I'm not going to read out exactly what's on those slides because you can do that for yourselves, but you can see that that whole environment is around about driven by the need, driven by that self-fulfillment of I want to know this, I want support to know this, I want to cultivate interest in this, I want to encourage other people to get involved in this, and then I want to integrate that into my general way of working. Next slide, please. And so the way that we're doing that is through a number of different initiatives that we have as part of AnalystX. So we have, in terms of education, numerous bits of guidance. We have the AnalystX Observatory, which you can go and have a read about all of these things. There's too many things for us to explain on a slide. And then we've also got things around support. So Hexi time is a way of saying, I've got an amount of analyst time that I want to put into a bank that you can use, and then you can withdraw from that or you can deposit to that. And it's a way of getting the community to work together on a problem and solve that problem potentially quicker and maybe with more innovation. We've got opportunity to cultivate those sorts of areas. So ALX and dataversity, again, go away and have a play and have a look at what those are. Huge part around integration. So there's a big piece of work that we're doing within NHS England and with other partners around about the professionalisation of analytics and having a real defined pathway based on different personas. So if you are a data scientist, what you might need to develop; if you are a chartered statistician, what you might want to develop; if you are a person that works with data day in, day out, but doesn't consider yourself an analyst, you probably are. So you need to be thinking about what does that mean then for your own development and your own progress. And then lots and lots of fantastic fun things that we do. We have some huddles and mini huddles. There's no food involved, unfortunately, because they are mostly virtual, but bring a biscuit along if you choose to. But these are, again, discussions and presentations of what people have gone away and learnt, what they've done, how it's worked for them, and again, encouraging other people to get involved and work on those things. Next slide, please. So I'm going to hand over to Sarah after this, but essentially I just wanted to cover the 10 commandments of successful collaboration at scale. You've got to have that clarity of your strategic objective. What is it you're wanting to do? Clear and simple is best. The more that you get into the granular, oh, it should look like this or it should look like that, the more difficult it is to sort of sell it as a vision for people to get involved in. Allow that space for your community to evolve. If you have a too preconceived idea of what it's going to look like, then it's not going to be driven by the community. You have to have that space for them to go, this is what we really want, and for them to grow it and to work with that and not sort of stifle that if it's going in a direction that you weren't necessarily expecting, unless it's kind of going really like away from something that you're interested in. You've got to do a little bit of gardening, but realistically, you want it to be driven and used by those members. Bring sponsors and other leaders into the governance, and not just people from health and social care. Look to business, look to industry, look to innovators about how they've developed a community of practice, how they've got the buzz going about the work that they're doing. Find champions. hello, for people that want to talk about this kind of stuff and that want to get out there and explain why it's helpful and why it's important. For those, that can be topic driven, or it can just be specifically around communities. I'm very interested in making sure that data analysis interpretation is accessible. We don't use lots of big language where we don't need to. We don't create clever slides where we don't need to, that people go away understanding what it is that we've talked about when we talk about data and analytics. You've also got to regularly feed it. You've got to keep involved with all sorts of different parts of expertise, or bringing in different aspects that you might not have thought about before. And, you know, use every opportunity, make contact with somebody and say, hey, do you want to come and talk to our community about this? Because that will be what keeps the interest going, and that will be what keeps the variety accessible to your membership. Promotion, this is what we're doing right now. Promote it to other networks, keep people talking about it. Have your cheerleaders within that, and make sure that your leadership has that knowledge to get them out and telling people about what this is all about. Community practice needs to be peer-to-peer. So we're not interested in hierarchies. We're not interested in, we only want to hear from this person because they've written a paper about it. We want to hear from you regardless of what your interest or experience or knowledge is in an area. If you're passionate about it, we want you to be part of it. There needs to be some way to monitor the success, but think about what that is. It's not just about some metrics. It's about, did that engagement land? Did people go away going, that's brilliant, I'm going to use that locally? Did you get somebody come up to you and go, hey, I've heard about this Analyst X thing, can you tell me some more about it? Yeah, brilliant. There are different ways of measuring what we've done and how that's going to work. And self-promotion, as the membership needs to be kept informed of what we're doing well. So we're not very good at this as a community of analysts and those who work in data in general. When we've done something brilliant, tell people about it, tell people about the impact, show them the change that was made, because that's how we get people to recognize the impact of what we're doing and the way that we can actually change things using data by driving better decision making. People are only going to respond to that when they see that it's worked somewhere else. So keep that in mind, keep promoting it, and keep thinking about what this community can do for you, what you can do for the community as well, to get it out there and make sure that people understand that it exists and how they can get involved. Next slide, and then I'll hand over to Sarah.
Thank you, Rachel. Just a quick intro to myself. I'm Sarah Blandel. I'm lead for analytical development in NHS England. I've been around in NHS in AnalystX since March 2020. I'm one of the founding fathers. It sounds really quite ominous, but I'm also the workstream lead for communities, networks and learning. So we have a few people that sort of sit as a core team who volunteer to at least keep the wheels on the bus going with that feeding the beast, as Rachel mentioned it. So I'm going to talk you through, obviously Rachel's talked about the community and the overarching aims and ambitions and what it is and what it isn't. I'm going to tell you a bit more about what's on there. So to whet your appetite to come along, become a member and get active. So obviously there's a whole range of content, as you can imagine, where a community creates and designs itself and evolves over time. So obviously we've evolved around particular areas, you know, what data is out there and can be accessible, what, you know, helping to case for, you know, shine a light on people's case studies of their work and data and analyst communities, etc. Actually, that membership figure is now incorrect. We have now crashed the 18,000 barrier, which is fantastic for us. But also, I mean, one of the areas, unsurprising enough, I'm going to be biased because, as I said, I look after communities, networks and learning, which includes the huddle contents and links into other networks, as well as the learning zone. So it's been very much focused from my area of work around promoting and linking to initiatives that encourage and make it much easier for people who work in data and analytics to access training, because there is a significant amount of learning and training opportunities out there. But actually, you know, getting access to things traditionally have been quite challenging. So a good example for this is we constructed the Analyst Learning Exchange, which was very much around introductory bite-sized modules of content that then would link out into learning paths from our different software providers. So not just providing theoretical how-to, but also then, and how do I apply that in different pieces of software? But as you say, we've linked into other people's training events. We link very much within our strategic partners, highlighting events and training and webinars that other people do through our centralized events calendars, obviously promoting very heavily the NHSR Communities Conference that starts tomorrow, for example, or the Insight 2022 Festival from the Midlands community that starts next week and carries on into early December. But these are the types of things we link into our, just to really raise awareness of opportunities for training and development that happen across the system. Next slide, please. One of the ways we've been able to do that is very much as Rachel has said, by thinking outside the box of who we want within AnalystX. And when we talked about, pan organisation, we really meant it. We meant going outside of the traditional health and social care partners and thinking about what we can learn from academia, but also what we can learn from industry. So AnalystX has very much reached out, and we now have like well over 40, almost 50 strategic partners that are involved, which some of those names you will recognise, I think. And they've been very much on a sliding scale of involvement from we'll link through into the materials that we have and already made available to people, to actually we'll put on bespoke hackathons and training opportunities for people within the community, very much to help support. There's been some fantastic partnership working that's come out as a result of these strategic partners getting involved in AnalystX, and more case studies on that work to come, because as you say, it's an ever evolving feast of work, and it's a fascinating piece to be involved in. Next slide, please. So how can you get involved in AnalystX? Well, obviously, please do become a member. That would be fantastic. It's a brilliant way of getting involved. But there are some early areas where I would suggest you sort of start taking a look into, one of which is obviously the discussion forums. As Rachel has mentioned, if you start a conversation going there, you will definitely get some responses, especially if it's very much asking for help and support, or trying to find networks of your peers. We also, I should say, we have regular huddles. Please do go ahead and sign up for one of those. As I say, we have them on a weekly basis, and we will push out the monthly content in advance, so you know what you can sign up for. We have a real range of content, from trying to keep at least one slot a month for timely, whatever is sort of being discussed at the moment, showcasing learning opportunities, showcasing other people's analytics. We have a regular slot called a Machine Learning Monday. So for those of you who are actively interested in data science and machine learning, we have a thriving sub community there who have a regular slot on our huddles area. We also have a Fika podcast series, which is basically slightly different because it's more about the individual and getting people's career stories. So there's some really, really interesting back episodes of that if you do enjoy a good podcast while you're working. We're very active on social media. We've obviously got the atypical usual ones that you would expect. We've got a Twitter account, we've got LinkedIn, but we also have AnalystX TV, which is something that obviously we are bringing in and using that to then showcase individual pieces of content. There's a really good launch episode on there with Muir Gray, if anyone is interested in checking that out. One of the areas we keep our community agile is in the sub communities. So this is basically where AnalystX provides the infrastructure and the umbrella for peer-to-peer networks that sort of want to meet on a regular basis to talk about a particular area. So probably more similar to a user group style format. So we already have sub communities around, as I mentioned, machine learning. We have a really vibrant visualization, a really great evaluation community of practice, etc. And also the NHS Python community launched out of AnalystX and is now going fantastic good guns with having their own thread at the NHSR conference. So they're meeting on the 17th if anyone he's a Python user and didn't realize that they have a thread in the conference and they have their own community. Please do get involved. And obviously other contents for newsletters, blogs. I run a learning and development blog which pushes out learning opportunities, etc. There's lots of things to do as early checkouts. Next slide, please. So obviously, one of the things, as we said about those umbrella areas very much, is that what we also are trying to do. Oh, sorry, I had a network echo back from someone then, is to provide links out to other network groups through the AnalystX community, and therefore the health stats user group has its own page under that networks section, which is obviously where we are then trying to promote some of the fantastic resources that sit within this user group out into the AnalystX community, and encourage them to consider whether or not therefore that user group would probably be of something of use to them. And this, we are doing this obviously with wider groups as well, some of the cross networks that exist within the East of England, as well as some other user groups. So next slide, please. As I mentioned, there are existing AnalystX communities you can join. I mentioned the ones that are already up and running. We are imminently to be launching an SQL community, and areas that we're looking at in the future is data privacy and data ethics. We also have a process mining community that has been set up. So there's some real interesting ones there. But as this is led by the community, it is very much driven by that idea of what people are coalescing around at the moment, where we can find a core group of people who we can help support to take those areas forward. Thank you. Can I have the next slide? So as I said, how to get involved, it's quite simple. If you literally type in AnalystX in a certain very well-known search platform, we come up at the top. It's quite simple to find us. You can register because AnalystX is hosted on the Future NHS platform. So you will need to register for one of those accounts. As a result of that, you then can follow us on social media and Twitter. That will then give you a really good idea of what's the newest content, what's the newest things we're pushing you towards. Obviously can access any of the sort of curated topical content through our huddles, through our CNL area. You can share your knowledge as soon as you're a member. We actively encourage people to do that, to get involved, to join our sub-communities, to start posting through discussion forums and making connections. Or of course, if you really, really passionately want to get involved, then you become, like Rachel, one of our AnalystX champions that can get more involved. Can I have the next slide, please? I've obviously added this in because I think it links in quite nicely with the conversation people have had around what does this mean for growing one of these communities if you want to do it yourself. And I think there is something there around, at the very start of a community, you do need a core group of people that are incredibly committed. It doesn't have to be a large group, but it does need to be a committed group that will be able to move something from an idea and potential into an organization as it's forming. We're now very much on the cusp of being self-sustaining. I say this on the cusp because there's still elements, obviously, from an infrastructure perspective that requires support, but we're very much in that area of transitioning into that self-sustaining community area. But there is something there around, how do you develop at scale, at pace, and requiring that sort of that element of really front loading the resource, expanding quickly enough that you can get enough new ideas to be able to come into a community, and so sort of sustaining that, keeping the interest there in order to then transition into self-sustaining, where you've then got, as I say, we've now got 18,000 membership, a significant amount of push in from our strategic partners, as well as different initiatives, and encouraging people to make their home on AnalystX and becoming that umbrella means that these little communities then become the real engines that drive the content on there. So for anyone who's considering setting up their own community of practice, we'd obviously be happy to provide that information and support going forward. I think that's our last slide, but one more. Next. So yes, what's next for us is obviously AnalystX, like the Health Stats user group, is a membership community. So sometimes people come in and they click on a link they found off of the web and they get rather disappointed because they can't find anything. So one of the things we are doing is putting a new front web landing zone on front that's built out of GitHub, which will allow you to at least come on and find some more detail about AnalystX, and make sure check it out to see if you're something you're interested in, and then go on to membership. And I think we're at the end now. Thank you for listening.
Great, thank you very much, Sarah and Rachel. I think it's a very exciting development, and obviously we will be continuing within Health Stats user group and RSS official statistics, continuing discussions with Sarah and Rachel about how we can sort of link in and collaborate in terms of taking this forward. But obviously interested in any comments from people on this webinar, as well as how to move forward with this. And now we move on to the next speaker, which is, this is what Rachel and Sarah is very much kind of like bottom up the community, but there's been also a lot of involvement from the top end down, which is what Tegwin's going to talk about, which is the new user engagement structure, the new user engagement strategy. And then obviously we want to talk about how those things fit together. So over to you, Tegwin.
Lovely, thank you very much, and hello everyone, and thank you, Dina, for inviting me to this session. Yeah, I'm Tegwin Green, or Teg as I'm more commonly known, and I work in the communications division of the Office for National Statistics, and leading on a project to introduce a theme-based approach to our user engagement right across the government statistical service. So on the next slide, you'll see, as a bit of background, this theme-based engagement work, it stems from the development of the user engagement strategy for statistics, which was launched in February last year. And it was developed after talking to users and producers of statistics. And it has 3 goals, and, tying up very well with the presentation we've just heard, it's, about collaboration, so getting better at collaborating across those different boundaries, across professional, organisational, geographical boundaries. And another goal about building engagement capability, so as producers of statistics, learning how to engage more effectively, more broadly with our audiences and our potential audiences. And then really changing the culture of engagement so that it's better built into, to everybody's business as usual processes, becoming much more second nature and built in, like a bit like quality assurances in the statistical process. And really, the point of this is that those 3 strategic goals are now being taken forward by a new engagement hub at ONS, which I work within. And it's also being taken forward through the introduction of theme-based engagement. And that's an approach that when we talk to users of statistics, they told us that was sort of what seemed sensible, what seemed helpful for them to understand, how to share their views, who to get in contact with. And so that's what we're sort of driving forward. So on the next slide, our mission statement for theme-based engagement. And really it's about providing an easy and simple entry route into the world of official statistics for those people that perhaps, aren't as used to dealing with statistics. And another role about actively reaching out. So that's reaching out above and beyond, the people we're good at engaging with and our key users, but reaching beyond that and building at the same time sort of interested, inclusive, diverse user communities under that theme-based approach, sort of under them and across them. And about providing practical opportunities, I think, for producers and users of statistics to actively collaborate in the development of work plans, so that, highlighting and addressing data gaps, influencing how statistics are presented. And that's really so that a much broader range of people feel that they have a voice, they feel included, and the fact that their opinions are valued and listened to, and that there's a sort of a co-creation going on with statistical products and services. So that's sort of the mission statement. That's what we want to achieve. And on the next slide, it shows us the 12 core engagement themes that we've started off with. And each of those themes is led by a member of the senior civil service. And from the list here, there are sort of 9 of them are led by divisional directors from the Office for National Statistics, and the other 3 by the heads of profession from other sort of relevant government departments. And each of those leads is then supported by at least one, and some possibly a lot of the time more than one deputy from another government department. So we've got that sort of collaboration sort of evident right at the top. And these are the core engagement themes, we've sort of labelled them, because we are also aware that there are already, and there will be more that come up, sort of cross-cutting themes such as national statistics or inequalities that often do and already have their own separate forums for discussion. So they might not neatly fit in these boxes, but we do want to make sure that these discussions feed into the themes, and so perhaps be sort of standing agenda items within them, and opportunities for those subjects to be discussed and kept on people's radar and sort of actioned and sort of escalated appropriately, I think. And today's focus predominantly about health and social care statistics. The lead for that theme, which probably a lot of you already know, is Julie Stamborough from ONS. But she leads this very much in conjunction with all the members of the English Health Statistics Steering Group. And we'll talk about that a little bit more a bit later. But on the next slide then, I just want to touch a little bit more on the roles of sort of the theme leads and the deputy theme leads. And they're the named champions of the theme. They'll be chairing a regular theme-based user forum, and very much based on their knowledge and experience working with users of their statistics, they'll help identify engagement priorities as well as gaps in the user communities, and really sort of encourage that much wider and diverse membership of the theme. And as part of that, theme leads, so we don't want to work in silos. This is what this is, we're trying to be helpful, but we don't want to create new silos or anything else. So we're very conscious about bringing theme leads together regularly to identify, discuss sort of challenges, to discuss new and existing cross-cutting issues that need that further action or escalation. And just to make sure that knowledge is shared, and common challenges are perhaps addressed together, and that the views from their users are fed up, and we can see what commonalities there are going forward. So then on the next slide, it just explains a little bit more about the engagement hub, and that hub sits a central resource for sort of the GSS predominantly, but sits within ONS. And it's made up of 2 teams, an external affairs team and a Pacific sort of outreach and engagement team. And the teams work closely together a lot of the time to address ONS business needs, but also with an overall purpose of developing and promoting the infrastructure that is needed for engagement, and in particular for the theme-based engagement model that we're taking forward. And really with a role to facilitate more collaboration between producers and users of statistics, but very much building on what already exists. And then I suppose the outreach team, it's about reaching out to those wider audiences, the ones that might not traditionally engage with statisticians, with the Government Statistical Service, and very much building on the work done as part of the census engagement, with outreach to local authorities, to community leaders, businesses, universities, the voluntary sector. So a lot more of a focus on broadening the user base. But at the same time, to make this a sustainable model, a large element of the external affairs team work is about the continuity of building relationships and partnerships with a full range of new and existing external stakeholders. And it's sort of that expertise and that resource that we want to be using, a combination of all those services to support the ambitions of theme-based engagement, and to help fill audience gaps that are identified within the themes, to promote that active involvement, both within the theme, but also opportunities across the themes too, to discuss work plans with relevant audiences, just to make sure we're sharing the good stuff and the successes between ourselves and with others. And the next slide then just highlights some of the things that have happened to date on the infrastructure side. So we've recruited leads and deputy leads for the 12 core engagement themes. Met with them individually to understand the current landscape. So we're in the process of sort of mapping that out and identify engagement priorities. We've got some new web landing pages on the ONS website and the analysis function website, and the pages on the analysis function website will be developed further with additional information and hopefully links to promote existing user forums and existing events. And then last month we met with the economy theme leads have met to discuss sort of common challenges and common ways forward. And then we've had an all theme leads meeting in October to identify sort of priorities and agree sort of roles and responsibilities going forward there. The next slide then just summarises a little bit some of the sort of the things, the feedback we'd had from those theme leads, who acknowledged, this was a big task, and we all need to work together and utilise what already exists and the good things that are already being done. And I think some of the things that they raised were the fact that it potentially might not be meaningful to convene all engagement at this top theme level, especially for the larger, more complex themes such as health and social care. And sort of that essence of being proportionate and understanding and utilising existing mechanisms. And they did recognise the need, I think, as we all do, that we have to work together. So there has to be some infrastructure, but also it's that bottom-up approach that will probably provide the building blocks, and a lot of those are already in place to feed up those views. And to make us all feel part of this community that is working together to co-create the statistics and the data that we need. So really utilising the engagement that already happens through user groups and the work of the GSS Champion, User Engagement Champion Network, and understand and build on that current activity. And I think that's very much what we've heard, from a lot of people that we've talked to. And then the next slide just covers, where I'm sort of bringing it back to the health and social care theme and thinking about, well, I think this is where the operating model that you currently have could really help others. And I said earlier that Julie Stamborough is the named lead of health and social care theme, but from the outset, she and all members of the English Health Statistics Steering Group have been, really keen to stress that it's all of them that are championing and leading the theme. And, we can see from the membership list here and the objectives that, its role is really well aligned with the ambitions of theme-based engagement, with specific objectives to increase user engagement, to improve accessibility, remove duplication of effort. And yes, it does have a distinctly sort of England focus, but also has mechanisms in place to include discussions and work with the devolved administration, so work across the UK. And then on the next slide, something else that, that this theme is doing really well and has established already is these sort of theme groups, the 15 established theme groups. And I think that is a really good model of engagement for these larger themes, where engagement at the topic level is probably likely to be, more meaningful than at the high level theme. And so do need to think, as I know sort of you are by my discussions with Julie and with Emma and even with Dina, about the role of these 15 theme groups in terms of user engagement, involving users, and about the coherence and engagement right across the countries of the UK. And then the next slide, again, it's sort of highlighting some of the mechanisms that you already have in place within this theme that we are hoping to introduce for other themes. So that's sort of the fact of a regular newsletter that goes out, regular webinars. You also have the bonus of a sort of an interactive tool, and so I'm hoping there are good practices and successes others can learn from what you've put together. But at the same time, appreciating that, there isn't one size fits all across all these themes, because some of them are much more, much smaller than others. But I'm sure there's lots we can learn from each other. And I think sort of the last slide is sort of about, I know today's focus is about how we can do things better. There's always room for improvement. And I'm just really very interested to hear about your ideas for working together to improve engagement, for health and social care statistics, and indeed learning, or using what you've learned and thinking what could be shared with the other themes, and capturing your ideas, for what you have about taking forward theme-based engagement using the existing user groups and things that we have in place, not just for health and social care statistics, but much more widely too. And so, yeah, that's really just a brief summary to put everybody, up to speed of where we are about the ambitions we have. I'm going to pause there and hand over to Dina, I think, who's got, a little bit extra to say from the Stats User Forum before we sort of stop for perhaps some wider discussions. So thank you.
Yes, great. Thanks very much, Teg. So I'm handing over to myself here, but just to say all the things that Tegwin's mentioned, I mean, some of them have been in operation for a while, some are just starting, but if you are not aware of them and you need to know more information, like you didn't know about the regular newsletter, please let us know. You can either contact via the user engagement hub or through us, through the Health Stats user group, and we can give you more information on that. So, please get involved. And with the theme groups, the individual sub-theme groups within health and care, if that's your area, then please, once again, let us know, because they need to involve the user community a lot more. So some are at early stages than others. So if you want to know more information, either drop in the chat or email us and let us know. So now, just a little bit from me about some comments back from the user forum, which hopefully gives the speakers a bit of a chance to look at what's come in the chat, because after this, I'll then hand over to them at the start of the Q&A to respond to some of the comments that people have made in the chat. What has been mentioned very much is the idea of not being in silos and working across different organizations, across different groups. And one thing that is been very helpful in that is the overarching Stats User Forum. Well, this is an umbrella organization for user groups for all aspects of statistics users. So this is not just health and care as one of those, and Health Stats User Group has been very active within that, but there are many other areas of statistics which interact with health and care. So having some kind of organization where we can talk to each other and exchange ideas is very helpful. Back in the old days when it was kind of user groups that just met in rooms and had face-to-face meetings. So for those who are not familiar with Stats User Forum, there has been some kind of umbrella organization for at least 50 years, very long time. But the main purpose is increasing the use and usefulness of official statistics. It's changed in the way it's set up and the way it's run. It was from 2003 to 16, we had organizational and admin support from the RSS, and that was actually supported with a grant from one of the research councils, so that was very helpful. And then in 2017, ONS took over support for it from 2017 until the launch of the new strategy. Now, obviously, with the things that Tegwin's mentioned, there are some things which are now being done from the centre, from the hub. So arrangements need to change, and essentially support for Stats Usernet, which is this website where Health Statistics User Group has its web pages and is being set up for user interaction. That will continue, but the support for the forum as it stands has been discontinued. So some things continuing, some things not. So next slide, please. So the members of the user community have been looking at this and saying, well, how do we move forward in this new area with the user engagement strategy? And it's clear to us that not all of our activities are covered within the user engagement strategy. What we are expecting within the strategy and with what Tegwin has already introduced is that the following will be covered, although in fact not all of these are happening yet. Some of these are in early stages. Continuing support for the website Stats Usernet, maintaining and developing it and improving it. It's great, but it does have some drawbacks, and we're hoping that this will develop and improve, or there may be new ways of providing that support. So that's very important. One thing that we had been able to do was updates from ONS and producers on various developments as they come up, and providing opportunities for the user community to give feedback, ideally at early stages or when things are just about to be published, in a much more interactive way than just posting it on a website. So that will no longer be within our remit. We are assuming and hoping that there will be some mechanism within the new arrangements to do that. And then within the specific themes, that is very important development, of which health and care is one. Within that, coordinating the various user engagement activities, and then crucially identifying, liaising with the various groups. And it's no longer groups, it's networks, communities of practice, the sort of things we've been talking about so far. How do they all get involved within user engagement in a way that works for them, that works within their space in the way of working? So we're looking to the new strategy and the new mechanisms to try and lead on that and help support the user community there. But next slide, please. That it doesn't cover everything that we used to do. What it doesn't really cover is some of this interaction between the users, sometimes in the way that the AnalystX community were talking about, opportunities for the individual user groups to interact and exchange ideas on good practice and ways of working, getting together across the user groups. And then what that had led us to be able to do is identify areas of mutual concern across the user groups, including some cross-cutting issues, diversity, local area statistical needs, and others. So that's something that when we're actually organized in themes, which is very helpful in one way, you lose that cross-cutting discussions. And then that has allowed us to facilitate a broader and more strategic response on issues of concern. So you're not just responding within your particular area, but you're seeing how the user community as a whole views this. And then you can give a more thorough, more thoughtful response to proposed statistical developments and cross-cutting issues. So those sorts of things aren't really well covered, that user community interaction and working together, by the slightly more top-down approach and the theme-based approach that Tegwin's outlined. So next slide, please. Where do we think we should go forward with this? So this is now our proposed way forward, and we had a discussion which would be like our final meeting of the Statistics User Forum, which was last week. and these proposals were agreed by all of the user groups and the user community, is that SUF has been disbanded, but it will be relaunched, re-energized as an independent forum of user groups. But when we say user groups, we're talking about any sort of user community, user networks, a much broader focus, and focusing specifically on the sort of activities I mentioned that are not covered within the user engagement structure. This new forum will ensure it establishes links with Office for Stats Regulation, and we're already discussing with them, and then obviously establishing links with the new user engagement structure, with the theme groups, and also with this acronym, which is the National Statisticians Expert User Advisory Committee, which is a kind of overarching group. So we're already talking to them about how we might want to raise common issues of concern. In terms of moving forward with that, since we no longer get any support from ONS, RSS will be invited to host it, and they are interested at the moment in doing that. But obviously, it's work in progress. We're expecting that it will be launched in late January. There will be a virtual meeting to gauge interest, and then maybe we'll be able to have a face-to-face meeting and discussion with people after that. So that's the way forward that the user community sees, but very much working in collaboration and cooperative with what Tegwin's mentioned in terms of the more top-down theme-based approach. So that sort of is an immediate response to the user community's thoughts on the way forward and user engagement. So that's all I wanted to say from that. So we now move on to the Q&A section. So if I could ask the speakers to sort of come back online and see them and voice themselves. So can I now ask you to, you've been looking at the chat, and also bearing in mind that not everyone will have seen the chat. So if you're responding to the chat, can you actually say what it is that people asked you for? So can I just check with Rachel and Sarah, can you first of all pick up on some of the comments that's been made to you and respond, please?
Absolutely. So we had some really interesting questions within the chat around some of the functionality of the site, what types of, how the site is constructed, etc., how you can find things. It is a common problem, I believe, within AnalystX, that people struggle to find some things, and that's a valid concern. One of the things, obviously, people were particularly interested in was finding about the huddle and the huddle schedule that we mentioned for our webinars. We do have a special huddles page, which I have put a link to in the chat, where you can go and find all of our November events. There are quite a lot of things that are actually scheduled on for November. Another one for tomorrow. We've got another 2 the following week, and then a final one on the 29th. So please do go and have a look. Everything is also listed on our events calendar that you can access. Rachel, you had one that you replied to about strategic objectives for the site.
Yeah, so a good question about, what are we trying to do? And I think it all just wraps up quite neatly into our mission statement. And I think I touched on the fact that we can't be too prescriptive over a strategic objective for it to deliver a certain thing or for it to achieve a certain thing, because the whole point is it's there to facilitate what other people want to get out of it. And so it's only going to be as good as the membership and the passion that comes from that membership around the discussions that they want to have and what they want to access. So our strategic objective really does just reflect that mission statement. And then there was also part of that question was about the journey that we've been on. And I think hopefully the slide that you put up, Sarah, about kind of how that's grown and how you then maintain that, and then it sort of becomes self-sufficient, sort of explains a little bit about the journey, but happy to pick up anything more about that.
Real. And then we obviously had a sort of a cluster of questions, which were, I won't say the specific company involved, but that were around, obviously, how do we maintain the sort of integrity of this movement while still having industry partners involved, etc. And I think we've been very clear since the beginning in AnalystX that we've had a code of conduct that's on throughout the section around that we are all coming here as a peer-to-peer network to share learning and knowledge, and it has not been around commercial relationships. Obviously, if people see a really great example of a piece of work that's been done by a particular in collaboration case study with a particular software company and a particular part of the NHS, and then choose to follow that up independently, then that's something they've chosen to do from their own legal organisation and not from AnalystX. As I said, all strategic partners have a real sliding scale of how involved they are. With some, it's been more about, here, let's link to material we're already making freely available to people. And that is the particular case for that company. All the way through to some who are far more active and supportive and providing a lot of resource and involvement for free. But as we said, within AnalystX, one of the key things, one of the areas on one of our key areas of guidance is actually around data governance and management, etc. So obviously it's like with anything, we're a community of practice, we are sharing things within our membership, but we're still abiding by all the data governance restrictions that will be in place for all legal organisations. So no one's getting access to anything here. The only difference is it's a more trusted environment for people to feel like they can share things at a draft stage, probably, rather than waiting for final publication, because they know they're going to be able to get that really great advice and feedback from people. Thank you.
And just to pick up as well, one of the other parts of that question was around about ethics and how do we discuss that on the platform. And I think Sarah touched on the fact that that is an emerging community in discussion around data security, data management, data sharing, the ethics of how data is used. There's certainly a lot of noise in general going on about the use of patient and person information for things outside of direct care. Completely relate to my role in population health management. I couldn't do my job without using information about our patient populations. But do those patient populations know that that information is being used beyond direct care? So there's still a lot of those things going on. The Office of the National Data Guardian is about to do a piece of research on understanding of how people are using data beyond direct care, which I'm going to be involved in that piece of work. So that's still a very open question, but it is definitely something that as our community, we can share our thoughts on what is ethical, what isn't ethical. And as Sarah said, in that trusted environment that we're not going to get somebody go, but you're wrong. It's there for open discussion. It's there for interpretation, and it's there for learning and to have that space to be able to have those conversations in a safe way.
Great. Thanks very much. I mean, just actually also picking up on, you were talking about the sort of integrity. I mean, one point within our Stats User Forum and the user communities to say that they are all independent. So although we're working very closely with ONS, GSS and all these other colleagues, that it's very important within the user community that we maintain our independence from anyone with whom we are working, so that we can have an independent voice and we can feel free to say what we think is right. And I think that maintaining that independence and level of integrity is really, really important. So I think that's another common theme, but obviously the ethics thing is a whole other topic to discuss. One point in terms of the organisation of this, just in case people are frantically writing, just to reiterate again that the slides will be posted very soon after, almost immediately after the webinar, but also everything in the chat, including all the useful links and that people have been putting in there, we capture afterwards, and then that is included in our final report that will go up on the website in a week or two's time. So everything in there, I mean, if you want to see anything immediately, obviously capture it now, but everything that people have posted and responses will be in the final report, which it'll be posted on the website. So now, Tegwin, and there have been a few comments to you. Do you want to respond to any of the things in chat?
Yes, I can do, yes. So there was a question about when I said we wanted to reach out to other audiences, and it says, do you use usability testing on the products and services you put out there and on the content, whether it's understood or not? We don't, within the hub, we don't do that, but we have got sort of user researchers within sort of the digital publishing section of the communications division that do usability testing on the statistical products and services and on the language we use, that sort of thing. So that does happen, but I think it was more when I was describing about reaching out to those new audiences. You know, there are focus groups that happen, and there are sort of small discussion groups, both to raise awareness of what an interest in the statistics that are produced, but also asking them, you know, for their views, and the things that are important to them, I suppose. So it was more like reaching out to the areas of the community that probably aren't proactively visiting our website, engaging with us, or but just, yeah, that bit more targeted approach, I suppose, is what I meant as part of that. And
I think with reaching out, it's very much this going into people's space where they are engaging amongst themselves and finding out a way of interacting there. I think that's something that comes top down, doesn't, it always is sort of maybe a bit onerous. They've got to do something extra. So I think that's the way we're trying to understand where people actually discuss things, and then how do we actually bring that in. But it's a bit of a challenge, I think.
It is, and I think there's a lot of work that's been done as part of the census engagement, when we're getting everybody to, you know, the different communities and faith groups, and to realise that, you know, the importance and their role and what they could get from the experience. And so we have, in that particular team, has established some good relationships with those community leaders who also act as those advocates, and, you know, just share our information, but like very much you say, like in the forums that those people are used to discussing things in. So there's a lot more of that going on in a local level, with in the different regions and local authorities, but also, yeah, with, I say, particular faith groups and you know, people that aren't naturally, perhaps don't think of themselves as represented in the data that we do publish.
Yeah. Now, I would. I mean, there's more that we can discuss amongst ourselves, but I just want to throw it open for if anyone hasn't put something in the chat, and I will take one of the sort of hands up if people want to. We have actually got it so that people can unmute themselves in this one. Quite often we don't do that because we've got so many speakers and so little time to respond. So if anybody has other things that they want to comment on and other questions, if you want to use the hands up, and I can hand over to you, and you can actually unmute yourselves if there's anyone else who wants to make a comment. So while I'm waiting, in case while people might want to do that, I just wanted to myself say, thinking about the linkages between the theme groups within health and care, and the various sort of communities on AnalystX. AnalystX, some of those communities seem to be more on methods, but actually you could actually have communities for particular areas of application. So would it work to have those sub-theme groups, health and care themes, as communities within AnalystX? So that's a place where everybody working on that particular area of health and care statistics could discuss amongst themselves. It's a platform where those theme groups, the health and care theme groups, could actually use to actually discuss with people working in that area. Would that work? I mean, this is looking to you know, Sarah and Rachel, as well as to Tegwin. Would that be a way of using that AnalystX communities of practice and linking it into what we've got within the health and care themes? Any thoughts? No one's unmuting themselves there. Sarah?
Yeah, I think it would definitely work. I mean, just as we have people that are coming to AnalystX for particular technical areas, we have people obviously who are coming from a domain knowledge perspective. So I think if we set it up correctly, if we get the sort of the right momentum behind the discussions on the groups around it. What we've learned from AnalystX is we need to do a relatively large build-up and awareness campaign to make sure it filters through people coming on the site. So we probably need like a month or so build up to make sure really get the momentum going, and getting some launch events in is always a useful thing as well to sort of give people the chance to learn more about it and what that means. Once we've got that head of steam up, then it tends to sort of take on a life of its own, I'll be honest.
Yeah, I was just going to say exactly the same as Sarah, really, in terms of the technical home for it. Would that work? Absolutely, yes. But it's about getting that engagement and getting the right people to be part of that community, to, like we said earlier on, having those strong leaders within those communities that say, this is what we're talking about, this is how we're going to do it, this is how we're going to push it forward. Because we can set it up, but if nobody's actually in it, engaging in it, leading the content, leading events, then it doesn't necessarily get the engagement that we would want it to have, because there is so much going on. It's very difficult to kind of see every little thing that you're like, oh, I wish I'd have got involved in that. Whereas if it's a webinar that says, this is what it's all about, this is what we're trying to do here, come and get involved, or something similar, then there's more likely then people are going to engage with it and connect with it and sign up for the notifications for that area, etc. So yeah, technically absolutely no reason why that wouldn't be an appropriate platform for that to happen, but it's about how you get that.
It's how you get there, and it's the people stuff. Yes, yeah. Right, we've got a hand up from Grant Henderson. Do you want to unmute yourself and offer a question or comment, Grant Henderson?
Yeah, hello there. That was really interesting. I just wanted to ask, in terms of somebody who's not an analyst, so I've worked with data for many years. I love data and sometimes I understand it, but most of the time I've got an analyst within a team who helps me with it. But what I'm trying to do is learn more about data and being like yourselves. So while I'm never going to have the time to become a full-time analyst, I still want to try and increase, my skills, my abilities. Is there somewhere within this community that you think that I would fit in with that? Or because, and no, with all due respect, just because life's so quick, and I try to speak to us and I say, oh, what does this mean? And sometimes they explain it to me, but it's so fast paced, and the things that they say, it just raises more questions. So for me, it would be lovely to have a calm, slower place to ask questions. Do you think that's something relevant to this, or?
Absolutely. We have a rate. I mean, obviously, although it's data and analytics community, it's actually for people interested and active in data and analytics community. So we have a quite a reasonable proportion of membership of people who sit in more of the program management, project management sphere, as well as sort of people who sit in senior leadership who sort of dabble in from an AnalystX perspective. So yes, absolutely feel free to. Our discussion boards are very friendly places to come in and ask questions, but also when we've been thinking about our learning material, we have set up a learning persona called consumer. So these are people that would consume data and analytics products, but wouldn't necessarily create them or be involved in the storytelling or editing or data wrangling. So within our sort of learning materials, we have set up that's a consumer profile. So you can come in and look in ALX, look at what you might need to learn from a skills perspective for consumer if you want to. Similarly, for the population Health Centre of Excellence, they have set stuff up under their curriculum. So if you want to learn about population health, they've created the same consumer profile. You can come in and look at it from that perspective. And this is the start for that as well. We are looking at how else we can do some of the work we're moving into now from our training perspective of working with some of our strategic partners has been around how do we help non-data people enhance their data skills in areas that might be most relevant for them. So for example, simple visualization. So there will be some things we will be coming out with relatively soon. We're going to trial it in the Northwest first. And then see what the demand has been and the uptake there, because they've got a really great Northwest skills framework network that exists and has for quite some time. that will then look at how that works and then roll that out wider. So please, yes, very safe community. Long answer to that question. I'm very sorry.
No, it's really good though, but I'll keep my eyes out for the dabble group.
Yeah. And I think just to follow on from that, so in my sort of preamble at the start, even though my background is as a statistician, the thing that I care more about is how are we using it, and that you don't have to be an analyst or a statistician to use data, to make decisions based on data, to look at visualizations that then help you draw a conclusion or help you tell a story about what has happened. And what we have certainly found in population health management is there's quite a gulf between the level of understanding of how to interpret what their analysts are telling them to then be able to make a decision from that or draw conclusions from that. So we're working in exactly that space of how do we educate the casual users, the consumers of data and analytics, to feel confident in asking the right questions in the first place. So I want to know this. Often you get somebody come along that say, oh, I want a dashboard that does this. No, you don't. What you actually want is the answer to this question, which we can give you very, very simply. So it's about empowering you to ask the right questions, know who you should be asking those questions of, know if you're not getting the answer back that you were looking for, know how to kind of challenge your analysts and say, no, you've not really heard what I was asking for. I need something simpler, or I need something that I can go and talk to a finance director about, or whatever it might be. So there's definitely that's my jam, is that kind of whole area. There is definitely lots and lots of resources out there to help do that, but I definitely think that there would be like you say, a dabbling area that we could establish for those that just want to dip in and out of, how do I ask this question, or my analyst has come back with this and I don't want to offend them by telling them I haven't got a clue what they're telling me. How do I address those conversations? So yeah, definitely get involved, and if that isn't there, start it, or drop me a message, we'll start it together. But yeah, there are already things like that, but it definitely have a look and see what's there, and it's very friendly, and hopefully you'll be able to get something out of doing that.
I love this dabbling area. I think I'm going to be looking forward to this. I think this is very good in that. But I mean, the thing really is that the people who actually use and make decisions based on health and care stats, health and care data, I mean, probably the majority of them are not analysts and experts in data. And so in this field, it's really, really important that it's accessible, and that people that want to use it know where to go in feeling in a non-threatening way to learn enough so that they can actually access and use it. So this is really, really important. I mean, it's a great question, but it's also a challenge for people working in this field to make sure that people like Grant and others, many others, can actually access and use things appropriately, and they know enough and know where to go.
Yeah, effective communication of data and analytics and statistics is one of the key barriers that we found in taking good decisions. It's just that people don't feel confident necessarily in understanding what it is that they've been presented, and challenging when they don't understand what's been presented. So yeah, that's definitely something we're very keen to work on.
Yeah, Tegwin, do you want to come in with any thoughts on this?
Well, yeah, I mean, I asked the question about, I was very interested from the outset about the platform that you use to have those discussions on, because I think a lot of the barriers that we've faced is people saying that, especially across government, having a channel that everybody can contribute to is the first hurdle. And then, like you say, the other hurdle is obviously getting that interest and getting that momentum going. We did try using Slack for a while for some of our sort of discussions with theme leads, or even across the champion network. So I'd be very interested in exploring it a bit further with you, for that with the topic groups or the theme groups for the health and social care statistics, to see, what we could do, because yeah, it's great that you've got this platform, and I didn't know much about it beforehand. So, and the fact that you say it's technically possible to do, I think it would be really good to have some discussions with you, thinking about how we could, yeah, move that forward a little bit.
And ideally, those themes that within health and care should be starting to broaden out and involve not just the expert users, but anyone who's interested, or it's a particular area of interest of theirs. So it should be possible to engage the more general user, the casual user, however, you know, the consumer, whatever words you use, because there are many of those, and they're really important to support them. So yeah. Any other sort of other aspects that anyone wants to pick up on? I don't see any other hands coming up at the moment. But I mean, there's always opportunity to follow up on the links, or on the on emailing us. So, you know, this is always, these things are one stage in the discussion, and we hope the discussion continues. I'm sort of, I mean, one of the things that I'm obviously really concerned is the amount of support needed, that the user community are always very, very busy, and it's the same number of people doing things, and it's how we make this easy for people to interact and work with. I mean, it seems that AnalystX has got lots of enthusiastic people and they're spending the time, but it's really quite difficult to work out what's the best thing to spend your time on. I know when I first signed up, I was completely snowed under with all these things, and I didn't quite know how to fight my way through to the thing that was going to be of interest to me. And I think there's something around how do you highlight and sift out things that are relevant to you. And I really like the idea of your front pages that could maybe bring out key issues, and then you know that it's worth drilling down and following in. And I'm hoping that we can do something like that with the Stats Usernet. I mean, obviously, I've got some discussions to go on with Tegwin about that, because at the moment, you know, you've got to go right into the depths, and then you don't know whether or not that's going to be of interest to you. So something that highlights things, and then you can make a decision as to whether it's relevant to you, I think is really, really important. So, you know, that's once again, follow-up discussions. Any other sort of questions? I'll just go back round in terms, any sort of final thoughts. We'll be taking it forward. Sarah, just any, you know, sort of, it's been really useful to exchange from these different angles, I think.
Absolutely. I mean, we've obviously come out of today already with new areas of development and conversations for AnalystX, which we hadn't even considered. I love the idea of a dabble area personally. I can't wait to look at how we can do that, as well as how we can explore on the theme. I think it's really useful for us because we've really focused so far around technical skill development and sharing domain knowledge through case studies, that it will be really interesting to sort of actually start doing these cross-cutting themes, because it enables so many people to get really to the heart of what they're interested in quicker. So looking forward to those follow-on discussions.
Rachel, anything you wanted to final thoughts?
Just to echo that point, really, about, you know, the possibilities are endless. I think somebody maybe once said about how we use this, and it needs to be driven by our membership. And if we're being told that these are areas that people want to have those opportunities to connect with the people, then that's what we're here to do. We're here to facilitate those conversations. I've just mentioned as well, there was a comment about the sort of how do we help with that sort of communication of information. I've just tagged a team that's within NHS England called Making Data Count, if people haven't come across them before. They do amazing work making it very, very simple to understand what you're learning, what you're hearing, how to interpret it, how to read charts, how to have those conversations with your analysts, how to stop spuddling. If anybody wants to know what spuddling is, go away and investigate. And so I'm happy to connect people with them as well, because they're doing some great work in making sure that the communication aspects aren't creating barriers in that good decision making, and that people understand the numbers that they're being presented with.
Great, yes. Tegwin, any final thoughts?
Just to echo really what's been said, I was sort of excited about the opportunity to follow up with, in particular, Sarah and Rachel, but yeah, as well, anybody with the conversations of how we take this forward to the next steps. I have just noticed another question that was posed to me in the chat, which asks about, will the approaches to theme leads be in the public domain? And I think that's probably referencing, well, if somebody makes an approach to a theme lead, will that be made public? I don't really see any reason why it shouldn't. There's not that mechanism at the moment, because at the moment we are sort of filtering communications to the theme leads via our engagement hub email address. And then we are sort of feeding that up to theme leads. There hasn't been an awful lot, because we're sort of at the beginnings of the promotion stage of this. There hasn't been a lot of comments certainly directed to the theme lead. It's more about sort of interested in what events and, you know, things they can be signed up for and can get included on and get to hear about. But, you know, I don't really see any issue with, is that materialises why that wouldn't be the case, but there's no mechanism in place at the moment. So just wanted to answer that while I spotted it. Thank you.
Well, I think that's obviously very important, because it's sort of like, you know, on these discussions, when one person raises a question, someone, oh, that flags up another thought, and someone else offers a comment. And so actually, you know, you're not then doing it in isolation. Then the community can start to say, oh, that's a good idea, I could follow that up. And it's not just like a one-to-one discussion. So opening it out, I think, would be really, really helpful in terms of things that are raised. It broadens the discussion, brings more people in.
Yeah, definitely, I agree. So I think that's something we can certainly, look to build in when, yes.
And I think one final thought for me, which is something else, which is that on training and development, with another hat on, I'm very involved with developing the training programs for the new apprenticeship in health and care intelligence. And actually, there's so much material in here. I mean, there's material in our webinars, but material you've got on your website that I think it'd be really good to trawl through that and say, for this particular aspect of this new apprenticeship scheme, here is where you actually find the training material, and actually involved in these discussions. That's the way you learn, rather than, oh, here's a set lecture. So I think it'd be really good to actually run through material against the standards for that apprenticeship scheme and say, oh, for this module or whatever, point people in this direction on AnalystX. So I think that's another thing for us to follow up. It's all very exciting. So I think we're just about almost out of time. So I would say thank you very much to the speakers and to all the questions and comments in the chat. As I say, we will be following up. We will be writing a report on this, so you can see all the very useful material that's provided. Do send us comments. Do follow up on any of the things that we've talked about. And thank you very much for your participation. And keep an eye on the website for further information and for further webinars, and AnalystX as well. So thank you very much. Enjoy the rest of your day.
Thanks for having us along.
Bye.
Take care. Bye.
Bye.